Hello, my name is Adele and I'm an ACHA physiotherapist. This short video will outline information to assist your recovery from gynaecological surgery. Please remember that the information contained in this video is general advice only. You should always follow any specific advice and instruction given to you by your specialist. Your operation may have been performed through your abdomen or your vagina. Recovery will vary depending on your operation, general health, age, lifestyle, and fitness level before the operation. The day after your procedure, aim to get out of bed and walk around the room with your nurse. You'll be assisted to sit out of bed in a chair. Each day, try to increase the number of times you sit and the length of time you sit for. To assist with tissue healing and recovery, it is important to rest lying flat in bed 2 to 3 times per day for at least 20 minutes. While some pain or discomfort is expected after surgery, it is important that you are comfortable enough to move and cough effectively. Speak to your doctor or nurse to ensure you have adequate pain relief. To reduce the risk of complication after your surgery, you should aim to start deep breathing exercises as soon as you wake up. Take 5 slow, deep breaths through your nose, remembering to expand your ribs and relax your shoulders. Hold each breath for 3 to 4 seconds, and then take a couple of normal breaths. Repeat the cycle 4 times. If you notice a rattle in your chest or feel that you need to clear some phlegm, try a huff. This is a short, forced breath out, similar to fogging up a mirror. Huffing replaces a cough, which can place stress on your wound or pelvic floor. Should you need to cough with an abdominal wound, support your wound with a pillow or your hands. Should you need to cough after vaginal surgery, support your hand firmly over your pad. If you are experiencing lower back discomfort due to spending long periods in bed or need assistance with bowel motions, pelvic tilts can help with this. Lie on your back with both knees bent so your feet are resting on the bed. Gently arch your back to allow your pelvis to tilt forwards, and then flatten your back on the bed to tilt your pelvis backwards. Repeat this 10 times each waking hour. Gently brace your lower tummy muscles prior to and during any movement, which will support your wound and reduce backache. Remember that gentle walks and regular position changes can also assist with low back discomfort caused by immobility. This technique minimises pain and reduces strain on your incision. To get out of bed, lie on your back with your knees drawn up and your feet flat on the bed. Roll onto your side, keeping your hips and shoulders in line, and keep your knees together. Try to avoid twisting through the middle. Lower your feet over the edge of the bed as you push up with your elbow and hand. Reverse this action to return to bed. Sometimes, in the early days after gynaecological surgery, you may not have full bladder sensation. This is normal and will improve with time. When trying to use your bladder after surgery, sit comfortably, lean forwards, and relax your tummy and pelvic floor. Do not strain. Take your time and aim to pass urine every 3 to 4 hours. Drink normal amounts of liquid, aiming for mostly water, between 1.5 and 2 litres per day. If you are having difficulty passing urine, aren't noticing signals that your bladder is getting full, or you're experiencing leakage of urine, it's important to tell your doctor, physiotherapist, or nurse. Often after surgery, your bowels may take a little while to return to normal regularity. This is very normal and quite common after gynaecological procedures. This can be because of the procedure itself, changes in diet, pain medication, as well as reduced physical activity. It is important to avoid constipation by ensuring that you eat plenty of high fibre foods, for example, fruit and vegetables, drink plenty of water, and walk around your room often. To avoid straining on the toilet, ensure you use a footstool to raise your knees, relax your abdomen and pelvic floor. Avoid holding your breath. If you have vaginal stitches, support your perineum by applying pressure with a clean pad. The pelvic floor is a group of muscles and ligaments which support the bladder, uterus and bowel. Following gynaecological surgery, strong pelvic floor muscles will help support remaining organs and help to keep a healthy bladder and bowel. Conversely, a weak pelvic floor could lead to bladder, uterus or bowel prolapse and/or urinary or fecal incontinence. To perform pelvic floor exercises, lie on your back with both knees bent and feet flat on the bed. Gently squeeze and lift your pelvic floor as if you are stopping yourself from passing wind and the flow of urine. Ensure you relax and let go of the pelvic floor between squeezes. Gradually progress these exercises and start to perform them in sitting and standing. Do not perform these exercises if they cause pain or discomfort. Do not hold your breath. Do not tighten your thigh or buttock muscles. Keep them relaxed throughout to ensure you're only targeting the pelvic floor. You can usually start these exercises once your catheter has been removed, if you have one. Aim to do 10 long squeezes of your pelvic floor, holding each contraction for up to 10 seconds, with a 10-second break in between. Then do 10 short squeezes, quickly contracting your pelvic floor muscles and immediately letting go again. Aim to perform your pelvic floor exercises at least 3 times per day. If you would like further guidance on pelvic floor exercises, please contact a women's health physiotherapist after your 6-week review with your surgeon. The following information is a general guide describing how you might return to normal activities. It is important to remember that every body is different and you should always listen to how you are feeling. Signs such as a dragging sensation in the pelvic area, pain or excessive fatigue may indicate that your body needs more rest. If in doubt, contact your surgeon for further guidance. Rest flat on your bed 3 times a day. Take regular short walks around the ward or your home. Avoid lifting more than 3 kilograms. Avoid sustained postures. Complete pelvic floor and abdominal exercises as prescribed by your physiotherapist. Rest when you are tired. Increase the distance of your walks as able. You may begin light activities around the home, such as gentle gardening or cleaning, as desired. Start driving again with your surgeon's permission. After your surgeon review, you may begin low-impact exercise, such as Pilates, swimming and bike riding. Continue to avoid heavy lifting or heavy gardening for at least another 6 weeks. This may be longer depending on your prior fitness level and surgeon's advice. You may resume normal sexual activity as comfort allows. Resume all normal activities. This may include high-impact exercise such as weightlifting or running, depending on your prior level of strength and fitness and your surgeon's advice. We wish you all the best with your recovery. If you have any further questions or concerns, please contact your doctor or your local women's health physiotherapist.